Tuesday. It's not Thursday, it's Tuesday, and it's 7 o'clock, and the amazing Jamie McClement is here with us. This is really exciting because we're stepping slightly outside what people are linking with arthritis. So everybody that thinks about arthritis, they think of joints, joint. But today we're going to step a bit outside of that, and we're going to open your mind to what else is affected with these arthritic dogs. We have also had a request to talk about septic arthritis, which we're going to crack on with first. But first of all, Jamie, introduce yourself. Let people know who you are, what you do, so they've got some faith in you.
Okay, well, I'll try my best. So I am a practicing vet. I work in referrals, mainly orthopedics. So I work all day doing joint surgery and management of osteoarthritis, which I've really made a point of clinging on to, even though a lot of referral surgeons, it gets a bit left behind, but it's something that I do every day. So that's my day job. I run the practice as well as one of the directors, three of us, and I work on the clinical board of IVC, which owns quite a lot. So like a parent group full of vets.
Quite a few.
Quite a few, yeah, quite a few. I'm not. I came through practice to get into referral surgery, so I did what we call a certificate, and I've also done a master's in musculoskeletal disease through UCL, through the Royal Orthopaedic Hospital in Stanmore. So that was quite cool because that gave me like a human perspective on things like osteoarthritis and fracture management. So that's me. That's what I do. So we can talk about whatever you guys want to talk about today.
So basically, guys, pose your questions. We will try and get to them as best that we can. So just be patient. Sometimes there is a little bit of a delay. But this is really exciting because Jamie is very special in many, many ways. But having greater understanding about soft tissue is something that excites me because it opens up treatment options to you guys. That's really important. So you're listening because you probably have an arthritic dog, or your friend has, or you've had one in the past, or you're going to have one, and you're thinking to yourself, what do I need to do? We're going to expand your mind about how to help your dog. But let's start off with septic arthritis, because this was posted last night.
Okay.
Let's just chat about it. What is septic arthritis?
So basically, septic arthritis is just when you get infection in the joint. So the joint itself, it's always quite easy to think about it as like kind of an empty bag full of joint fluid. It's not really like that. What you've got your cartilage layers that take the weight of the animal, and you've just got that thin layer of fluid that's like the oil in a gearbox, which is your joint fluid. Now, there you go. Right. So in the gap in the middle, the gap is actually mostly filled with cartilage in your average joint. Now, in a very arthritic dog, obviously the cartilage has worn away a bit, so you've got less of a joint space. Now, the problem with septic arthritis that you get is when infection gets into, so bacteria get into that joint fluid, and essentially what they can do is turn the joint fluid, so the joint space, into an abscess. Now, the classic way people used to think of this happening would be as if a cat bites your knee or you get a splinter, and that can happen. But when we see it in arthritic dogs who already have arthritic joints, it's usually happening in a slightly different way. So what you've got to think about is the changes that happen in an arthritic joint. Usually when you have your bone is very beautifully designed, and it reacts to the pressures you apply to it, so it's all smoothed and all the channels run in the same direction, and that's just the way it reacts to the forces that are applied to it. So it builds like a really nice scaffold, kind of like the inside of a cathedral. It's all arched and everything is beautiful. Now, when you get arthritis, you get all this new bone formation, and all the tissues thicken up and become really congested, and so do the blood vessels. And if you think of the blood supply to the body like the pipes, water pipes in your house, so when they're working fine, they work smoothly. You don't hear them at all. Once you start getting problems in there, like if you get limescale or something like that, you can hear knocking or rushing, and that's because the flow in there is turbulent. So instead of the water flowing smoothly, it's all jumbling around. Now the same happens in your blood vessels. So once the bone, instead of being all smooth and beautifully designed and efficient, is all complex and altered, then once that happens, you get thin and curved and tortuous blood vessels. Now we all get bacteria floating around in our system at various times, if you cut yourself or you get an infection or anything like that. And usually what happens is it floats around in your system until the body deals with it through your immune system. But if you've got a dodgy joint and all these dodgy blood vessels, it can actually get washed up in there. So the same as if you've got a broken pipe, you get limescale deposited. Here you get bacteria deposited. So bad joints attract infection. So your average dog has a bad ear, it has some bacteria circulating, you're fine, it goes away, the body deals with it. If you've got that bad ear and you've got a really bad joint, you can end up with a septic joint. Now, that is incredibly painful. That's the first thing. It's really painful. So when we see these presenting, okay, you might have a dog who's got a painful elbow, for example, and they're sore on it, and that's fine, that's normal. But they look like they've broken their leg. They're that sore. They're holding the leg up. It's swollen and hot and painful, and you can't move it, you can't touch it. They freak out completely. So often they present people thinking they've broken their leg. So the first thing is that it's massively painful, and the usual pain relief just doesn't touch it. The second thing is that the bacterial infection and then the factors that are produced as a result of it are incredibly destructive. So they just completely fast forward your arthritic change in the joint. So the degeneration just goes so rapidly. So if you leave a septic joint untreated for 2 or 3 weeks, you can get really catastrophic arthritic change. So the thing is to get it diagnosed early. And first of all, it's prevention. So, dogs that have arthritis, that have really bad skin, or you get a tooth abscess or anything like that, it is really important that you keep on top of those things. So skin and tooth disease. When the vet's bugging you about getting the dental work done, this is one of the reasons. But the second thing is, as always, what you're watching out for when you've got a dog that's got a problem like arthritis, like anything else, is change. You know your dog, and in arthritis, you do get changes, you get fluctuations, but they're usually fairly gradual and smooth. You'll get good days, you'll get bad days. If you get a real change, if you have a dog that is usually a little stiff on their leg, but one day they are super, super painful, as though they have fallen down the stairs and broken their leg, that is when sepsis is a possibility. So septic arthritis. Now, you probably all pretty much taken to the vet anyway, because you're sensible people and you do stuff like this and watch these programs. But that is it. And the thing with it then is you need to leap on it early. So most of these, you're going to need to diagnose it. Diagnosis, you just take a joint fluid sample. Often that has to be done under sedation or anesthesia because they're so sore. You put a needle into the joint, you pull it out. Now, joint fluid should be sort of clear and sticky and a bit goopy, and it just looks healthy. It looks like, I don't know, it looks a bit like, what's that thick drink you have, like Jägermeister or something? What's the one? Yeah, maybe, but it's just a bit goopy and clear and a little bit yellow. Once it's septic, it's cloudy and it's watery and it's ugly. It's really, really ugly. So you can see it just by looking at it, but then you put it under the microscope and you just see loads and loads and loads of white blood cells which shouldn't be in there, and that's the body trying to fight the infection. So it's quite easy and quick to diagnose if you know what you're looking for. Once you diagnose it, you've got to go on antibiotics. You have to, and you have to stay on it for a long while, because the antibiotics have to get into that tissue, and they're delivered into that tissue by these tiny, dodgy, tortuous blood vessels. So you often have to spend maybe 6 to 10 weeks on antibiotics to make sure that is cleared, because often you'll see the symptoms will improve quite quickly, but you stop the antibiotics and they all spring back. So the way I treat it is you find out, you confirm the diagnosis, you put them on really broad spectrum antibiotics, and you run a culture. If the culture tells you can step down your antibiotics, then great. You do it for 6 weeks, then you take another joint fluid sample, and if that is negative, then you can stop your antibiotics. If it's not, then you have to continue a bit longer and do it again. So once you treat it, then you should go back almost to how you were before. Usually the arthritis is, even if you get on it early, is just a fraction worse. But if it's left unattended, it can completely blow out a joint. So, I mean, don't go around panicking now that all your arthritic dogs are going to get septic joints. The vast majority aren't. But be aware it's a possibility if they suddenly get very, very painful. And once they've had it once, they are a little more prone to it. So you have to watch out for it.
So take-home messages for that, seeing it from a very first opinion vet angle. It can be very difficult to persuade owners to do the sedation, to do the further investigation. So they bring the dog in, the dog has gone from being mildly lame to quite severely lame. And you as a first opinion vet behind the table say to the owner, I really want to work this up. And you do have a little bit of a pushback from the owner.
Yeah.
Emotional driven or financially driven. There's a bit of a pushback sometimes. It's really difficult for us because we're going to take this further.
Well, I mean, often you don't, because often, in my experience, often the owner thinks the dog has broken their leg. So they are quite up for it. They, you know, this is not a sort of, oh, he's a bit worse than he was yesterday. This is usually, they come saying there's something really, really wrong. Because, you know, especially these dogs often will have arthritis in, you know, all their legs, just, you know, as usual, they're an arthritic dog. And, you know, they struggle, and yet they're choosing to walk on 3 legs, which, you know, is so it's an extreme change. So often the owners and the vets realize that something is up. So it's not usually, in my experience, I mean, I realize that I'm a very persuasive chap.
You're a big cat, and you are in a referral centre.
Yeah, so I think for first opinion, for owners, the take-home message is be aware that it's there. But the main message is not worry about septic arthritis so much. It's just if your dog changes dramatically in any way, you know, arthritic changes should be slow. I mean, if you slip on the ice and hurt your arthritic elbow, it's going to hurt more than a usual elbow, but it's, you know, it's going to hurt a bit, and then they'll get a bit better after an hour or two. With septic arthritis, if you, you know, that's an extreme change, and any change, you know, if your dog goes from, not just to do with joints, you know, if your dog's walking around and then the next day is lying still and won't open its eyes, that's extreme, and you would take it to the vet. I think for first opinion vets, the main take-home message is this exists and that's what it looks like. So if you suddenly get a dog that is, you've got a rapid change, and you know you've got it's really common in elbows, but you can get it in hocks as well. I mean, you get it in any joint, but elbows and hocks are quite common.
Do you see more of a chronic, just kind of drifting on? Because I know there's been a couple of times in my lifetime as a vet where we've put the dog on antibiotics for a different reason, and their lameness, their which we've kept separate, actually really quite improves.
Yeah, I mean, that's a bit of a tricky one, because that can come from a number of reasons. I mean, one reason that you get it as well is if they've had joint surgery or you've got implants next to a joint. So the grumbling ones often that I see will be related with bone plates.
Yeah.
You know, so you don't get quite this extreme presentation. You'll just get a dog that isn't doing as well as it should, and then you go in and tap the joint and you find it. Dogs that, like you're describing, that are just not great, and then you put them on antibiotics for a completely different reason and they get better. Now, that's a tricky one, because is that you have... well, it can be one of 3 things. One is that if you've got arthritis and you feel ill, you'll feel iller. You know, it'll hurt. Everything will hurt more. The second is that you could just be having constant, very low-grade sepsis, and the body might be pretty much on top of it, but not quite. And the third one was, I've forgotten. Yeah, not ideal. But what you can get is, with arthritic animals, you get changes in perception of pain. So you can get then misinterpretation of pain from elsewhere. So you know it yourself that, for example, if you have a bad back and then you have a really, really bad tooth, your back hurts more than normal. So it can be that. It can just be because arthritis can be quite subtle and insidious. If you've got a dog who has a really painful ear, they'll just present as resentful of contact, not wanting to walk, not being their usual self. Now, is that the arthritis or is that the ear? So I think certainly if for any other reason you put a dog who has arthritis on antibiotics and suddenly other problems go away, you have to think, well, why? I mean, okay, be happy, but think, why is this happening? Be happy, but try and follow it up.
Definitely had what you've described there quite a few times, where you've got a pain on pain and you're like 1 + 1 but it's equaling 5. And so an arthritic dog that then gets an ear infection and it's just like catastrophic pain. And it shows how complex this disease
and also we know that you get these changes like the hyperesthesia and allodynia. So if you've got a dog that is hyperesthesic, any changes that you then subsequently get will be magnified. So that is a tricky one. The grumbling insidious ones are more difficult, but they're rarer, to me, unless you've got implants in which case really the person who put the implants in should be concentrating at this point and thinking of this as a possibility. But acute septic arthritis is the one to worry about. So you do occasionally see it, that a dog is running along and gets a piece of wood in their knee, but that's hard to miss because you've seen it happen and there's a hole in the knee. The usual one that we see is this blood-borne, what we call hematogenous sepsis.
The take-home message for owners is expect a workup, expect that your vet's going to put you on a long course of antibiotics. Let's just go.
Well, I think the way to think of it is extreme changes deserve extreme action.
Absolutely. And I think one thing that I've noticed as a first opinion vet, sometimes there's a hesitancy in me to prescribe a huge pot of pills because it's an expense. And when you say this is 6 weeks of antibiotics and it's £180, you can just see them go. So
and also you're worrying you could be wrong.
And know that you're wrong. Potentially.
However, you would tend to see improvement very quickly. And the other thing is that this is why it's worth to do the fluid sample, the joint tap, because although I send them off for confirmation, I was never good at cytology and pathology. I had to do it a few times at college, and not because they liked me so much. But I can see this, down my microscope with my eyes. This I can do. It takes 5 minutes. So although you might not be able to predict the correct antibiotic choice from that, you know that you're dealing with a sepsis. Even if you aren't 100% confident with knowing that it's a sepsis, the joint fluid just looks extremely different. So it's an extreme change. So there's something very weird going on. So you can send it off to the lab, even just give 2 weeks antibiotics, and you will see a benefit from it. Then you'll get confirmation. But then you can say, well, look, we're proven. The owner is happier because they see the dog getting better. And then you have to crack on with it. And also, I mean, for first opinion vets, speak to you take a photo on your iPhone, send it to the pathologist, send it to an orthopedic surgeon, and get advice. And then you get some old balding guy like me with lots of letters after the name saying, yes, you're doing the right thing. And that always helps.
Perfect. So that's hopefully, I think it was Patricia that asked that last night. So fingers crossed.
Very good question. Well, did she have you probably don't know if she had a dog with sepsis. I keep saying sepsis. I know sepsis means something else as well. That means septicemia. I'm talking as an orthopedic surgeon. When I say I mean sepsis in the joint, septic arthritis. I don't mean generalized septicemia, which is a disaster.
Let's move on.
Move on before I get complicated and talk about
this. Right. We have one question. We're going to do that first, and then we're going to come on to my really exciting area. So what about you move, waste of time or a good supplement? Now, this is tricky, guys. Now, please respect this. Cat tries to remain very independent, and we don't want to get into any situation where we are potentially poo-pooing specific companies, and that is a real policy that we have, is that we're not going to start playing cat and mouse with different companies. We will talk about the content of UMove, which is green-lit muscle, can advise you in that sense. So green-lit muscle, good or bad? Good.
So green-lit muscle is similar. It's kind of like almost an analog for omega-3.
Yes.
Omega-3 we know has benefits. I think when it was first looked into, people thought it was a bit kind of hippie nonsense, but it is shown. I mean, this is cod liver oil that your grandmother used to make you take years ago, so she was right. What it does is it interferes with the same inflammatory pathway that non-steroidals interfere with. So, I mean, not quite to the same extent, but it down regulates the inflammatory pathway, so it reduces inflammation in the joint, and it also just contributes to healthy tissue manufacture and help with sort of kind of reprocessing. So all the time you're turning over your tissues, and it makes sure they stay in good health. So it's
just
not something that
cod liver oil before people go and start buying 6 tons of cod
it contains oil. It. So fish oils contain this kind of stuff, and green lip mussel is ETA instead of EPA, but basically it's a similar thing. So what it does is it helps your cell membranes moderate the inflammatory process. So it is true. It is true, and there certainly have been plenty of studies that show that high levels of good quality omega-3 are very good for you. Green lip mussel has also been shown in a combination diet to have a similar effect. So U-Move I like for 2 reasons, 3.
Careful with using names. Just careful with using names.
Okay, but U-Move does contain green lip mussel.
Yes.
Which is a good thing. Now, it doesn't necessarily mean it's the best of all possible things, but it's a good thing. Secondly, is people know about it and it is widely available. And thirdly, I know that they had a bit of an issue. They did try and do a big study to prove the science behind it. Now, they weren't successful, and that is not, in my view, because it's a bad a bad supplement. It was because it is very complicated to prove these kind of things, which is good because you want to make it high. But I like it that they tried, because plenty of people don't. They just turn out stuff. So I think
they did try.
Yeah, I think credit to them for trying, because you could just churn stuff out and not have it moderated and not try and invest in the science and not regulate yourself. So I think kudos for that. So it is a good thing. It's not my number one choice, but that, I think one thing that's really, really important when we talk about this, because I noticed looking on Cam and other dog Facebook pages and things like that, is that people sometimes get a little out of perspective in terms of how good things are, and therefore how dreadful alternatives might be. So things are either perfect or they're awful. And your choice of supplement is either the best or it's a waste of money, and it's too complicated for that. You're not expecting these supplements that you give them and your dog is magically better. This is all just contributing, and the question is how much benefit you get for how much do you put in. So for the understanding that we have currently, high levels of good quality omega-3 is the best. However, really, to get that high level of good quality, the only easily available one is other dog foods are available, but there's a prescription brand of food that has very good high delivery of very good quality omega-3. However, some people don't like prescription dog foods. Some people have no problem with prescription dog foods but don't want to change the food that their dog is on. So if you can't do that, this is another good thing you can do. So there are some supplements that people use and get in, all excited about, and I would say just, hang on, I wouldn't worry about that if I were you. This is not U-Move. I think is a good thing, and it is widely available.
Okay,
if you've got an arthritic dog and it's on U-Move, I would never say stupid idea. No, it's a good start. It's a great thing to be doing. It's better than a lot better than not doing it. Yeah.
Cod liver oil is still very, very readily resorted to. And I certainly have read not a strong candidate anymore. What's your thoughts on that?
Well, it's not a great delivery method, and what quality and concentration and all these things. It's not pure. It's something that contains these oils. So better than doing nothing, significantly better than doing nothing. Not, in my view, as good as U-Move, and definitely not as good as giving the JD food. However, it's going to help. You've got to always look at
you have to give so much of it because
you would,
yeah.
And then
so when
it's similar like
just a capsule. I sit there going, no, you 10 to get that quantity.
Yeah, exactly. And also it's very difficult often with the packaging to find out. And often the reason they're not branding how much is in there is because they haven't the faintest idea. So, so all these things, it's never as easy as good thing, bad thing, I don't think. Some of these things are more useful than others, and better quality and more reliable.
So let's get on to, somebody just asked quantity, and this always comes up, and in honesty guys, I've not read that there is a specific amount. People
well, there was a study so EPA omega-3, a guy called Bauer, sorry, a guy, it might not have been a guy, it might have been a lady, my apologies.
How rude.
Yeah, sorry about that. I just assumed it was and as I remember, it was for a 30-kilo dog, so like a reasonable Labrador. I think it was about 2,000 milligrams per day. And I think often, for example, the ones you will buy for a human adult in the shop in the shopping centre, that one. I have a feeling that their capsules for human adults may be 1,000. I remember having a good hunt on a huge variety of dog branded supplements that one of my clients brought me in, and I couldn't actually find a level on any of them. Now, that doesn't mean that they're bad or low level. They could be, but I don't know because they weren't on them. And, I mean, now this was a classic example because she had about 5 supplements that were all basically the same. So she probably was giving quite a good quantity, but it was all just completely reproducing itself.
Financial toxicity, guys. That is something that we are trying to stop you doing.
It's called wasting your money.
Yeah, a little story. I went to see a lovely old lady who was
with the best will in the world. She was trying to do it.
She went to the pet shop because she was too scared to see the vet. Was spending around about £85 a month on a number of supplements, so raping her pension. And all of them were unproven, unsubstantiated, overlapping, and it was just like, no.
Yeah.
And you needed your dog to be
that is it. And they're doing it because they want to help, and I appreciate that, but they could be helping. For a start, that money could be used for something that would be more beneficial. And also, it's just a lot of money, like you said. I mean, if you've got whatever 60 quid a week to live on, you want to be spending it all on stuff that's not going to work.
So the reason that we do CAM is for you guys to start having faith in us vets again. I want people to feel confident to go to their vet and say, what are my options, rather than being scared of going to their vet and going to the shelf that are not going to sell you necessarily the right thing.
Yeah, I mean, I think it's really important that everyone understands it's not either or. It's not medication or supplements. Okay. You don't choose. You're not like on one team or the other. They're doing different things. I mean, they're all helping against this problem, but they are doing different things, and you'll get different amounts of benefit in different ways. So putting your dog on an omega-3 supplement, despite what people say, oh, he's wonderful since, you're not expecting you put them on it and they instantly feel better. That's not what it's there for. That's what you will see on anti-inflammatories. However, that doesn't mean that anti-inflammatories are wonderful and joint supplements are bad. What it means is that you're trying to maintain as good a joint health as you can over time, and that's really hard to measure. And that's why they often get a bad rep, and also because they're completely unregulated. I could go and mix something up in my garden and sell it as a joint supplement. And
so that's what we call multimodal. So people that are new to CAM, please respect that this is called the multimodal approach. It's a very holistic approach. It is using different components of a treatment plan for an end result. It's not a religious war. We're not choosing one side or the other. You are allowed like to dip into different elements to get a good end result.
So, I mean, essentially what it means is everything in moderation.
Yes.
So you're not putting all your eggs in one basket. And holistic is a word that's been kidnapped, because often what you will hear is this idea: don't go and see a regular vet, see a holistic vet. As an orthopedic surgeon, I mean, it's probably true for other, I can't speak for other vets, but what we do is massively holistic, because holistic just means looking at the whole picture.
Yeah.
Now, when you're doing osteoarthritis, you're looking at your joint, but you're also looking at body weight, you're looking at diet, you're looking at environment, you're looking at general health, you're looking at all these things. That's holistic. So again, it's not one or the other. If you're doing your job properly as a vet, you must be holistic. That doesn't mean using tree roots and things like that. That's like herbalism or alternative medicine. Holistic is a different word. It doesn't also mean that all vets are holistic, because if you say my dog's got
Colin's here, everybody, Colin's here.
Oh God. But yeah, so I think it's a word that's been slightly misappropriated.
Yes.
If you do get a vet who you say, oh, my dog's got a bad leg, and he goes, all right, well, it's that joint, but he's not being holistic, but he's not doing his job properly. So I think holistic isn't the same as someone that doesn't use proper medication. And alternative medicine, it depends where you are. Again, it's a spectrum. In some ways, you could say that U-Move is in a way an alternative medicine because it's not a licensed drug. Okay, you could say that, but it's not, because it's got elements in it that have a level of proof. So again, you get this idea that you're one or the other. If science likes something, then is it bad? No, it's nonsense. And we're not out there to trick you. Honestly, if there was something in your kitchen cupboard that fixed arthritis,
yes,
I would tell you, because it would make everything better.
Just to help people out, there's a lot of people saying, just give us a guide and some figures. I think well respected globally is around about 100 to 150 milligrams per kilogram of a combination of EPA and DHA. With people that are asking about feeding oily fish,
I'm trying to do the maths. I think that's about right.
It's about the same as what you're saying. For people that talk about feeding oily fish as part of a fresh food diet, yes, theoretically, but we don't know how much omega-3s are in that fish for you. So yeah. I did remember looking at a comparison of pilchards around the globe. That is how sad I am. And there are different omega-3 concentrations on, say, Atlantic pilchards compared to, whatever. There's a massive variation there. So you're asking us questions that are quite hard to answer.
Yeah. However, ask is, it's our job to try and answer them. It doesn't mean it's a bad question. Don't give up asking.
No, don't give up asking. But I can remember I was reading, somebody was saying something like 6 grams per kilo for something like pilchards, but I don't know where they found that.
No, and also I think one thing that I think confuses people is that they will say, oh, my vet doesn't believe in these supplements or whatever. And I think it again, this is a difficult word, because as far as I'm concerned, there's no belief involved. It's evidence or not evidence. But my main thing is more how much benefit are you going to get from what I recommend you do. So I'm not going to recommend something that may or may not help slightly first. I'm going to deal with the important things first. So I know if you present me with an arthritic dog that is in pain and fat, that if I reduce its weight and give it an anti-inflammatory, it will get considerably better, and that is proven, and I know it will work. So I don't want to get tangled up in a conversation about pilchards versus cod liver oil. Yeah. At that point, that doesn't mean I don't care about omega-3. If I haven't mentioned it as a headline, it just means
that keeps appearing here.
Oh, sorry, yeah, those are mine. Yeah. What I mean, and I think that's sometimes where we get a little bit caught up. So, although they are a useful adjunct in some ways, some of them are not. Some of them are a waste of money.
And because we've already hit 30 minutes on something that unfortunately comes up again and again. Now, just please let me have a little bit of a soapbox moment, because it then leads us into the next section. I get very frustrated that we seem to get tangled in supplements so quickly when there's so many other things that are free of charge, easily accessible,
Yeah.
open to everybody, and that's where we're going to go. So sorry guys, for people that are desperately wanting to know more about supplements, please go and see the Facebook Live we did with Sean McCormack. It was about 2 weeks ago now. It went on for an hour and 45 minutes.
Mm-hmm.
Please go and look at that, because we need to move on.
But if I say one more thing about it is, do not stress too much about supplements. Do not stress. You know, if you're giving this one or that one or whatever, you're unlikely to be doing something disastrously, catastrophically wrong, whichever one you pick. So don't panic.
Don't panic, but use your resources well.
Yes, exactly.
Do not be a lovely little old lady.
Yeah.
Or pension on it, you know.
No, and don't spend your whole day asking 100 different Facebook pages, you know, the difference between two supplements. Just don't. It's a waste of your time.
Yeah, exactly. Let's move on. Really exciting. Right. So, because this really leads on to something that I'm passionate about, which is the home environment and lifestyle change and modified exercise and the interventions that owners can start doing, such as heat sacking, massage, stretches, you know, all of these sorts of things. Let's talk about the secondary effects of arthritis, because that's what's amazing. So tell us about compensatory change, soft tissue change. Just go on a little journey.
Okay, so I think what we're all very clear on at the moment is it's not that the arthritis stops as soon as you cross the cell membrane. You've got changes in the bone under the cartilage, which is where a lot of the pain comes from, but also you get changes in the the ligaments and tendons, because I mean the joint, when you see the model that you showed us, you know, you've got bone is white and then tendon is brown, and you know one's stuck on the other. But if you think that actually in the real dog, your your ligaments are actually just thickenings, if you like, in the joint capsule. So once you get an inflamed joint, then all these ligaments get altered, and then also the tendons that are the attachment from the muscles get affected. And once then you've got this envelope of altered tissue, the pain is bad. You then get these secondary pain changes that we talked about, this pain wind up. But once also the animal avoids, you get these muscle spasms. So you feel pain in the joint, and you get a spinal loop. So this impulse goes to the spine and straight back down again, which puts the muscle into spasm, and that in itself is painful. And then you get disuse of the limb, so you get muscle atrophy, which then supports the joint less. So it's all just a vicious circle. So and this is the problem with arthritis, is that it snowballs. You start with these smaller changes, and then everything builds and builds and builds. So you get these changes in the soft tissue, and you've also got to couple that with the natural aging changes that you get. So you're going to get reduced like flexibility and stretch and recoil in your ligaments and tendons anyway, because they often are older, coupled with then the inflammation and the pain changes and the disuse changes. So you then also have your neurological changes, which will affect proprioception and will amplify pain. So this is not, as you were saying before, this is not like your this is your joint, and don't eat that, buddy. That your joint on its own. Sorry, something. Could you just give me 1 second? Something fell off the table, and he's going to try and eat it.
We've got chaos in the background.
Sorry, that was Ludo. He's naughty.
Who's Ludo?
Ludo is my whippet. And he tries to eat everything.
We're going to rewind a little bit here. So slow down.
So it is not. If you think, kind of imagine like, okay, it starts in and around the joint. It's failure of the joint, but it just sends out its little evil tendons and tentacles into the surrounding tissue. Mm-hmm. So this is not just the joint itself. And then you've got to, you've got this envelope of abnormal tissue that sits around it, because you have inflammation slightly distant from the joint. You have degenerative change there as well. So it is bigger than just the joint. It's definitely bigger. And then you get this different type of pain that is associated with it then, because your initial joint pain is different to the muscle spasm pain, and is different to the stiffness ache that you get when you get up in the morning. So you're dealing with different tissues and different what we call phenotypes of pain.
Okay.
That was a long word.
So
Let's not use that
guys.
word.
So just pause. When you have arthritis, there are different tissues involved. It's not all about the joint. So I'm just going to keep people gripped with this, because let me just give you an example. Say we've got a dog that's got hip arthritis, and they can accommodate that discomfort. They're really good at concealing and just getting on with life and just pushing through. But over time, because it's a bit sore to use their hips through that full range of motion, other parts of their body have to pick up the slack. So they might start to shift their weight forward. Their area around the hip begins to tighten because it's not being used through the full.
Well, you can also see that they change the way they walk. And this is what we see with the bunny hopping when they run. So instead of running like this, they do this. And this is just them finding out that there's an easier way for them to do it, or a less painful way to do it. So these are what we call adaptive or accommodative changes in gait. So the dog has just worked out a better way to do that. And often then that gets difficult, because once they've learned that, even if you improve the pain, they might continue to do it just because habitually that's the way they do it. But yes, you're right. And then because they're now using it in a different way, they're walking in a different way that uses that joint less. They then use the joint less. So then you get more muscle spasm, you get muscle atrophy.
And what people have to realize is that we all have amazing coping strategies. That's why mammalian species are amazing, because we have the ability to cope with neck pain, even if the problem was right in the back end. Because
they can. I mean, they could have completely coincidental problems as well. I mean, also another thing I think that is really important is that as humans, if we have problems like this, we don't tend to think about it, because if, for example, as a human, you find that a particular type of flooring bothers you, you don't walk on it because you choose what you're going to do. But the dog often does, if you're not watching, because if you say, well, your bed is here and your food is there, they don't have a choice. The human would probably just go and put the food next to the bed, and they'd have their kettle next to their chair and things like that.
Let's stay in the pathophysiology before we start doing
Okay, sorry.
Yeah, just go back a little bit. So I think what I'm trying to make you say, I'm forcing you, I'm shoving you into a bit of a corner, is that people focus very much down on the joint, and they don't look at the global picture. They don't look at the whole dog. And we've had a few questions about people asking, how can I tell if my dog's in pain? My dog is stiff. My dog isn't so capable. And I think people have to realize is that it's not all about what the joint is willing to do. It's about the structures around it, and it's the rest of the body, what it can do. So let's talk about the bunny hopping dog. It hasn't got the ability to move those hips independently. It's using both legs together because they're both weak, but together they can get the same propulsion. So that dog's got an adapted gait to be able to do things. So you might have a dog that used to get on the sofa, but now it has to put both legs together and bunny hop onto the sofa to get the same propulsion. So when people say, oh, we can't do it as easily, and they say, but that's not pain. Well, actually, pain could have started the process that led to the not being capable.
Yeah, in arthritis, stiffness is pretty much always pain. Not always, but pretty much always. You can get some cases where you get a mechanical lameness, which is not directly linked to pain. Like if your joint, for example, is so arthritic that is basically fused in one place, then you'll get a limp that is not directly related to pain, although there will already be pain elsewhere. But mostly there's stiffness when you get up, and you know it because well, unless you're super young, you know this too, like that pain when you get up out of a chair and you've been sitting down too long. That's, you're stiff, but that's because it hurts. Otherwise you would just leap up and dance around. And dogs are the same. And dogs don't do things for no reason. If they want to get up and go and do something, they get up and go and do something. So if they are stiff and struggling to do that, there's got to be a reason, and usually the reason is pain.
But the pain can come from muscle, it can come from the joint capsule, it can come from the actual joint, it could come from fascia. There's a lot of different areas that pain can come from.
It will usually come from a combination of all of them. So the classic arthritic pain that you see drawn in books is subchondral bone pain. That's where your cartilage so cartilage is the thing, like the cushion, that's the shock absorber that acts on your joint to get them to move, the bones to move smoothly against each other. And if that erodes, so in humans they tend to talk about ulceration or fibrillation, and your cartilage is either worn away physically or is actually eroded by various factors within the joint. Now, once you expose that bone, you've got bone grating on bone. So that is the classic pain. But then, yes, you have what we call synovitis, which is inflammation of the joint capsule. That hurts. You have muscle spasm. That hurts. You then have this amplification of pain with a wind-up pain, which Matt probably talked about at length.
Yeah.
That hurts. Yeah, it hurts a lot. It hurts more than all the rest of it put together.
Where they say the forequarters have been manning up. They've been helping those hips out, and then they start going, "I hurt too." And
I do find people get a bit sometimes over the top about. You'll get someone that's coming in and the dog's got one arthritic elbow, and they will just spend the whole consult worrying about, well, is it going to put too much weight on the other elbow? Well, yeah, it will put more, but three-legged dogs manage okay. Although it is something to bear in mind and factor in. Your priority is dealing with the arthritic joint. Dogs' legs, if they're not arthritic.
I would argue a little bit of that because I do massage, and I rate it as being something that can have a profound effect. I think if you don't protect your coping strategy as feeling right. So if I've got a dog, so I've got a really arthritic one. It's 6-month-old Labrador, absolutely shot to the hips, terrible, never seen anything like it. And its front end is the only thing that is keeping. So for me, keeping the soft tissue happy and comfortable and moving is keeping this dog alive at the moment.
What I mean is that you may well get sort of reversible muscle pain. Like when you've been carrying too much of a bag, it's very, very, very unlikely that you're going to induce arthritis in the other leg because they're using it more. So I think that's quite a big difference. So yes, massage and heat packs, and things like that. But don't sort of over fixate on terrible damage that it's doing.
If people want to know more about the joints and overuse, go find the Facebook Live with Daryl Millis, where he studies where they put beagles on treadmills for 26 miles a day for 100 days and how the cartilage went, no worries.
Yeah. I used to, when I was a student, you have to do all these things on, go and do work placements on farms. And I remember I was working sheepdogs on Dartmoor, and I was getting tired of riding the motorbike before the dogs got tired of running. Dogs are just designed, and they're much more efficient at this than us. We as humans, we do often get primary arthritis from overloading our joints because, first of all, we live a lot longer than we were designed to. Secondly, we stand in a way that's very abnormal for what our joints were initially designed to do. And thirdly, we then do stupid things like play rugby or, go rock climbing and things like this. So primary arthritis is much more common. This wear and tear is much more common in humans. In dogs, if you're going to have arthritis, there's almost always a reason, because dogs are very, very well-designed pieces of kit in majority. Not some of these weird ones that people...
Be careful, you might lose your friends.
But, for example, Mr. Whippet over here will run and run and run and run. And, hip arthritis in sight hounds is almost non-existent because their hips just are well adapted for what they're supposed to do, which is running. So you're right. Things like beagles, beagles were bred for exactly that, just steady running all day long. And so you have to have an either abnormal joint or a very abnormal load to induce arthritis. So usually it's an abnormal joint or trauma.
That's a really good take-home message for a lot of people. And when I first heard this, it just resonated so much. abnormal forces through normal joints or normal forces through abnormal joints. That sums up why arthritis happens. So abnormal forces are that, I'm going to say it, bull chucker on concrete, twisting, torsion.
Fat.
Or fat, exactly. And normal forces for abnormal joints, your hip dysplasias, your elbow dysplasias, your OCDs.
Yep.
So let's just talk a little bit more about this soft tissue thing. The reason this is important to me is CAM was created to cater for people with all different financial capabilities, of all different backgrounds and all different physical capabilities. And something that frustrated me, and this is my personal opinion, is people latching onto supplements and latching on to high-end treatment and saying, well, I can't afford it, so I'm not going to go. There is so many things that we can do that we don't put a level of importance to. So
So number one, best bang for your buck osteoarthritis treatment. If you're talking about value for money.
Value.
Hot and cold pack.
Yeah. Explain why. So let's talk about cryo.
Okay, so
now, let me butt in. People don't add weight when you say hot or cold pack. They go, oh, that's easy. If you make it sound more technical, they think, oh, well.
Oh, yeah. All right. So thermotherapy, for example. Yes. So actually applying a heat pack is a lot cleverer than you would think. It's a lot cleverer than anyone realized. So we as humans put heat packs on us because it feels nice and it helps you feel better. That's it. That's why. Yeah. You know, I remember a complete analogy was my science teacher trying to explain to me that the reason that people started putting salt in the water when they were boiling vegetables was that it lowered the boiling temperature of water. No, they didn't. It did, but that's not why they put it there. They put it there because it tastes nice. Now, with and with heat packs, you do it because it makes you feel better. However, what you're actually doing is you are interfering with the you're basically creating a neurological override. Yeah. So you're actually tapping into the same, I mean, as well as just increasing blood flow, things like that, which is good because your increased blood flow will help with muscle spasm. You're also interfering and overriding the system. So it's the same, it's the same as when you have an arthritic dog that can barely walk but sees a bunny rabbit and they run. Because you've got this different nerve fiber. You've got your chronic pain nerve fiber that's firing. And then you stimulate this other nerve fiber that just overrides and it actually cancels it down. Now, there are a few ways that you can achieve this in a very complicated fashion. But one of these is heat. And heat is the dog that chooses suddenly to change its plan and sleep next to the radiator. Dogs do this, so they're self-medicating because it feels nice. But they're actually doing this complicated thing as well. Or you can do it through a hot water bottle or a heat pack or a very, very expensive laser. It's the same. Now the difference is that laser will penetrate deeper.
Okay.
But it is the same mechanism. You're using thermotherapy. So although, yes, you're getting delivery to deeper tissues in a more controlled fashion, at a higher delivery, it's the same mechanism. So if you can't afford a laser, you can afford a hot water bottle. So that is the difference. And if you're talking about lower joint, right up at the top with a hot water bottle, in your hip, it will help, not as much as a laser. No, not as much as a laser. Down around here in your elbow, there's not much tissue coverage. So the benefit of the laser is actually significantly reduced compared to your hot water bottle. Now, with cryotherapy, which is a cold pack, what you're doing is you're inducing localized cold neuralgia, which is numbing. You're numbing the area, so you're actually interfering with nerve transfer. And cold, the benefit, the action of cold takes longer to go away from the tissue than the action of hot, and you know that yourself because if you get cold, it seems to take ages to warm up, or if you get numb from numb fingers. But what that does is it acts to like a local anesthetic, if you like, and then that just allows you to reset and it takes that out. And what that does is actually decreases blood flow. So that is why you're better off using cold in acute inflammation, because you actually want decrease.
So let's just go back. So are we allowed to use that term pain gate theory? Because I think that's quite a nice way.
Yeah, I mean, why not? Why not?
Because basically your brain has only got a capacity to take in a certain amount of information. We all have an definitive amount of capacity.
Finite,
that's it. That's the word I'm looking for. So if you start plaguing your brain with other information, it can't process so much pain. So that's why licky mats and snuffle mats and distraction, as you were talking about, is very powerful. And heat is one of those that you can put in the surrounding area. It does have effect on blood flow, so that promotes tissue healing, etc., etc. Muscles respond very well. Cryotherapy works in the same way and affects nerve transmission. But when would we use them? So people saying, okay, I get it. Heat, cold, when? So when they should grab the bag of peas.
As the easy to remember one line is you just think about if you ever played rugby. Okay. So you just work it out from there. So before your rugby, you warm up. At the end of your rugby, you warm down. You do that routinely every time you go play. If you hurt yourself, you put the ice on. Same with dogs. So your heat pack, you would want to do sort of either morning and night or before and after the walk or something like that. So this is a chronic thing. This is for your chronic pain changes, your chronic degeneration. For me, the ice, the cold, as a basic rule of thumb would be if your dog was on a walk and twisted their arthritic joint. Now, if you're talking about on a more complex level with a professional physiotherapist or something like that, okay, there are differences. There are different times you would use that. But as your basic take-home message for people at home with your hot cold pack, should I be heating it or cooling it down? I would do that. So first thing in the morning, if you can put it on your dog while you're having breakfast, last thing at night. And you know, because dogs do this themselves, you know, they cart themselves off to sit next to the Aga or the fire morning and night. They do that in the middle of the day. They just get on with their lives. And you can warm them up and warm them down from exercise. So you could do that through stretches. You could do that through laser, but you can do it through your, if they hurt themselves, you then use the cold.
Yes, so we've had a few questions about heat therapy, and this is where I'm afraid there aren't these studies that we can go, yes, that definitely works. But people are asking about heat lamps, people are asking about what kind of heat packs. So for me, in my very, very owner-focused mind, I like wheat sacks, but I ask you to put them on your arm and check, because, you know, we don't want them too hot going on there. You also need to give your dog choice, because we don't know what they're feeling. And if you lay something on them and they go, that feels horrendous, they need to be able to get away from it. So please don't.
I mean, we have the same, because we often will use ice packs after surgery. We'll tell the owner, you do the ice pack this many times a day. And if they come back and they say, well, do you know what, it wouldn't let me do it. The answer is, well, either he doesn't need it or it's not working for him. So just stop. And, you know, I mean, with the heat pack, like you say, you can lie on your arm, but also if you're holding it on the dog and it's too hot for your hand, well, it's too hot for the dog, but the dog will have gone away by then, most likely, unless they're in terrible, you know, if they really can't walk, but they will let you know. And the same with you know, with ice, it is really important that you wrap this ice pack, because the contact will be too much. So if you're going to use the ice packs themselves, they often come with a cover, and you need to use that. If you're going to use something homemade, like bag of frozen peas, wrap it in a tea towel.
I think less is more. I think this is something that I didn't learn till I started doing more, and I think as more I've realised that less is more. Don't try and do everything, and don't go for really hot or really cold for really long. You know, less is more. Mats and heat lamp, your dog has got to have the ability to move away from them. If you have a dog whose mobility is really questionable and they really do struggle to get to a stand, don't just leave them on a heat mat, because they might be there just going, this is unbearable, but I can't get away from it. Don't put them over them, if they have difficulties getting out of their bed.
I mean, I think heat lamps are very, very cool if they live outdoors or something like that. But to be honest, the general ambient heat in a house these days is usually reasonable. If you're going to do one, I would just go and invest in your £3 whatever it is hot and cold pack from the chemist before you start getting complicated things. Yeah.
But I think it also leads on to the fact that there's a lot of people that are now investing in coats, and I did N=1 study, anecdote. I did see benefit in keeping my dog warm with a coat. And as she became more frail and she lost a lot of muscle mass, I definitely felt that she felt the cold more. Whether I made that up, whether I extrapolated from my dad that's got lots of arthritic change and he feels the cold terribly, I did feel that she got to her feet better, we could exercise more comfortably. So just think, these aren't expensive interventions and they can make
No, and I mean also, but you could. I mean, there are some dogs that just will not tolerate any sort of outfit. So you can do a quick trial with your own T-shirt, and if your dog goes nuts, then I wouldn't go and buy some expensive coat off the internet. Ludo here will wear woolly hats with antlers on and bow ties, so he'd be all right.
He just goes, I'm not moving. I am not moving. Somebody asked, how long would you leave a heat pack on for? What's the optimum time?
Optimums are really hard. I mean, you need to do it for at least 5 minutes to get any benefit.
I read about 5 to 10 minutes.
Yeah. So, and I wouldn't do much longer than that, because for a start, your heat pack's going to get cold. But that should be enough. I think 5 to 10 minutes is perfectly fine.
Perfect.
Yeah. Good question.
We've hit an hour. We'll do one more.
Don't go over 40 degrees. I wouldn't.
Yeah.
If you can measure that, but you probably can't. But I mean, the easiest way is if it's too hot for your hand, then it's too hot for the dog.
Yeah.
We're
going to do one more logical intervention. Then we're going to do 10 top tips because we're hit 61 minutes already. So.
Oh wow. Okay.
Talking in the soft tissue, more global effect of arthritis. What is another very easily introduced intervention? I need those words. So you're an owner, you're a guy that lives in Crawley, and you've got a Labrador, and you live just in a general house. What kind of things would you say is really quite important?
Well, I mean, do you mean with the house itself? I mean, you can be careful that you're not trying to get your dog to descend wooden stairs. I mean, that kind of thing. If they've got bad elbows, because they're going up or down, depending on which end of your dog is damaged. If your dog has problems with his back end, his hips and his knees, he will struggle to go up. If he's got problems with his front limbs, he will struggle to go down. So jumping out of the car, coming downstairs, especially on hard surfaces, is going to be difficult. So you just need to be aware of that. If you've got a little tiny dog, you can carry them. If you've got a big dog, you help them and you limit the amount of times they have to do this. And ideally, you get rid of if you've just put in tens of £1,000s worth of hardwood flooring, obviously you're not going to just rip it out and put a carpet, but just be aware of it. The other things you can do, especially if you've got the advice of a physiotherapist, is what we call passive range of motion.
Yes, go there. Tell us about that.
Well, this is we know that as your arthritis progresses, the actual range that the joint will be, because if you think about it as stiffening up, it's the same thing, but the range of motion that you can put it through will be reduced, and then the dog will choose to do it less even than that because of the discomfort, and then you'll get so what you can do is just put them through this range of motion. So the dog is sitting still and you're pushing him back. So like in a back leg, it would be like you're making him ride a bicycle, and you just do this nice and gently, and it's like how you would stretch before exercise. And how hard should you? Well, the dog will probably tell you don't want to be doing this hard to start with. Just do it really, really gently. Never do it more than if you push back on your fingers, you can feel the amount of pressure that is tolerable. It's about that would be the maximum you'd ever do. But you're just putting the limb through this range of motion, because the dog often will not now do it. Your normal dog will put the leg through that full range of motion hundreds of times a day, because they roll on their back, they run, they jump, they do all these things. An arthritic dog, because of this accommodation and because of the lack of range of motion, these joints will not do what they're supposed to be doing. So if you can do that 20 times, this bicycling, or in the same in the front leg, just put all those joints through their range of motion 20 times, morning, noon and night, that's going to reduce the stiffness and improve, and also help with your muscle tone and everything, because otherwise these muscles are not running their normal jobs. So that would be very easy. That's a lot easier to do than massage. I mean, basic massage, your dogs love it. I mean, they love it even when they don't have arthritis. You just heat pack and give them a rub and all that. But more specific technical massage can be a little, for physiotherapists. But passive range of motion is a good, easy thing.
A lot of physios and a lot of massage people are very happy to teach. So it's really worth seeing somebody and saying, look, I really want to maintain my dog when I haven't seen you for a while. What can you advise me to do? Passive range of motion is fantastic, guys, but always a game choice. And please look at what your dog's telling you. So if your dog is
I mean, you can see when you, especially elbows, if you bend up their elbow, when they do, what you're seeing is you'll push the elbow up like this, and you get to a certain point and the dog does this. And that's him telling you. But what you'll find, at that point you stop, you go back down again. But what you'll find is over a few days, then it will get slightly less. If he looks like he's sore, then stop.
And it is really powerful. So I've had, just using myself as an example, I've had really sore hips because I've been doing lots of driving around cam stuff, 6 hours in the car. And I started finding that my hips were getting really quite painful, getting pain going down the sides of the legs. And since I've gone back to stretching properly in the gym, and it's comfortable to stretch, when you really do make yourself, extend through your hips, you're like, not that nice actually. The results are amazing. I feel so.
And if you're struggling, what do? You get someone to lean on it for you. So this is all stuff. It's passive range of motion. So this is all stuff that we know we already do, but you just have to transfer it. But it's the same with people. A lot of these dog owners will have arthritis themselves, and you talk about this stuff. You say put a heat pack on. They go, oh yeah, I do that, and it really helps. Well, exactly. Of course you do, because you're sensible. If you've got that pain, you do it yourself. And if you fall down the stairs, what do? You put ice on it. So that you already know this. It's just that you haven't transferred. You haven't made that link. And it's the same with you and your stretching.
Really good question from an owner before we go on to 10 top tips. And I love this question because I think this is so important. Should they make their dog go for a walk? Now, obviously, if your dog is really uncomfortable, no, get some pain relief on board, get some support.
Okay, I'm going to turn the question just around slightly to make it, because that's quite a difficult question. What I would say is your dog must exercise. Your dog must lead an active lifestyle. It must avoid an inactive lifestyle. So that's not quite the same as dragging him along the street when he would really prefer not to. But if your dog with arthritis is completely inactive, it will accelerate the changes. It will accelerate the muscle wastage. It will accelerate the changes in the joint. So we already said this, moderation in everything. He must do moderate exercise. I mean, we talk about lead walking, and a lot of these dogs don't need to be on the lead because they just walk next to you and, they're in it's fine. But you know what I mean by lead walk? If they're posturing around next to you and not on the lead, it's the same thing. But they need to be ideally doing that. Now, some will do more than that, but that's the basic they need to be doing, which for a dog is not a lot of exercise. Like we were saying before, dogs can run, you should be able to run. But the difference between doing 20 minutes round the block 3 times a day and nothing is significantly bigger difference than 20 minutes 3 times a day and endless
I
exercise.
think a really good story that makes people realise how important exercise is. I was seeing a lady and she used to allow her dog to have a lay-in. So she had a very arthritic elderly dog, and she felt it was the right thing to encourage the dog to just sleep it off, take as long as it needed to get up in the morning. And by simply encouraging the dog to get up and have a potter around the garden, as soon as she got up and had her first cup of coffee, the dog's day was different.
Yeah.
Totally different. But getting them up and moving is really, really
important. Because again, we know this, and you look at people who are not so great, and we say, "Oh yeah, but they don't really, they keep going," and look, they do all right. And then the people that lie on the couch and don't move, and we see the documentaries on Channel 5 about those people. They don't do well, because you've got to, if you don't use your joints at all, they will fail. Once they've started with arthritis, it's although it may feel harder to make them do something, because initially it will be a bit sore. If they don't do anything, if you just sit there and think, I'll not move my joint. And luckily dogs are not usually like this. Dogs will take the more pragmatic, they want to go out and enjoy their lives. But yes, you should encourage your dog to get out, and you should be doing little and often. What you don't want to be doing is doing like a 2-hour walk, because you'll find that your dog will give up after 20 minutes. However, if you do 3 20-minute walks, they will also last that 20 minutes. So that's much better. The absolute no-no is not walking them and then taking them on a nice long walk at the weekends. No, that is not good for an arthritic dog.
Let's just go through muscle fatigue, because I think that's something that people really they need to know. So if you have got a limb that has a joint or multiple joints with arthritis, and we have got soft tissue loss and soft tissue dysfunction, we haven't got the same resilience and stamina and coping strategies that muscle would have had in its optimum time. It's more likely to fatigue, and if it's more likely to fatigue, then that limb is more prone to injury through balance or slips and trips and stumbles and catches. And we see this a lot as vets, where people say, "Oh yeah, going along the walk, he starts dragging his feet," and you're like, okay, if you're 15 minutes in and he's dragging his feet, that's when his walk has to stop.
Yeah, I mean, if you've got an atrophied muscle, if you've got muscle wastage, your muscle is not as strong and is not as fit. So it's like a weedy guy in the gym. He's not going to be lifting those weights for very long before he starts having to accommodate. Like me, exactly like me. So this is why I always used to have these trouble with rugby matches, because I just couldn't, and so if you've got a leg that has a really wasted muscle, you're right, not only is it not supporting these joints, so the joints are actually taking more of a beating than in a normal dog, that leg is just going to get tired very easily, because it's not got much muscle. I mean, it's really obvious when you think about it like that. It's just going to, you say fatigue, it's just going to get tired. It's not fit. And so the dog is not fit because they're not active as much. So they will get tired easily. So they won't, and again, it's the same as us. It's the same as if you don't go to the gym. It's hard to go to the gym, so you go to the gym less. And it's the same with these dogs, because they've not got the muscle that they need to do this motion that they should be able to do for days and days and days in a row. If they don't have that, dogs, your normal dog will never get tired after 20 minutes in the park. However, if he's not got the muscle mass that he needs and the muscle fitness to move all that Labrador repeatedly, then he will tire easily. And that's why you give short multiple walks, because you just give him his muscles time to recover. And you do that again and again, and you increase the muscle bulk and you increase the fitness. And hydrotherapy does that extremely well. So what the hydrotherapy is doing is it's allowing even a bigger range of motion than you would normally do, but with support, so that the animal is not overloading these joints. So if the water comes up to their elbow, they're basically carrying about 50% of their body weight they would normally when they were doing this range of motion. Up to the shoulder, they're carrying about 25% themselves. So it's just easier for them. So they get to do, and if they're swimming versus, we don't get too much in the technicalities of swimming versus treading. But basically you're extending their range of motion in a slightly different way.
You're doing a little bit of passive range of motion through the joint capsule. You're helping with muscle stamina, strength through the resistance training. You're taking the weight of the joints. This is a fantastic intervention. But I think my take home about the fatigue is I saw something horrible on Facebook once where a lady was told to get the weight off her dog and to get it mobile. So she started making it go up and down the stairs, and it wasn't capable. It just wasn't capable, and it fell down the stairs. And I was just like, why did anybody ever do that? Less is more. Build slowly.
Okay, well, I mean, a really good exercise, especially if they've got weakness in their back end, is just sit to stand.
Yeah,
that's it.
Yeah.
Sit,
but
stand,
start with 2,
sit.
build to 3, build to 5.
But again, turn that into human. What is that in a human? It's squats.
Yeah. I've got a funny story. One of my friends' mum just went to the gym, and she's quite elderly. She's got painful hips. And the PT instructor made her do a sum total of about 360 lunges in her first ever session.
Yeah, okay. I mean, that's just not sensible.
Stupid. Anyway, don't do that. Right.
No.
75 minutes. We're going to do 10 top tips, but we're going to have a very big focus on these interventions that are applicable to everybody. They're pretty much free of charge. So we're going to focus down 10 top tips that are available to everybody. So I'm going to start with number 10 because that means number 1 is a biggie, which is yours. So number 10, I'm going to steal one. Wait. I was in the pub at the weekend, always in the pub, and there was this chocolate Labrador, and it was 9 out of 9 overweight. It could hardly move. It could hardly breathe. It was miserable. Please, guys, get help. 9 out of 10 owners cannot see that their dogs are overweight. Get help. Nurses, vets, therapists, say something. You guys, talk to your family members. If you've got a person in your family with an overweight dog, give them a kick. Tell them the dog. It's really important.
It's not supposed to look like that. Okay, so I will go with what we were talking about earlier, everything in moderation. Exercise in moderation, food in moderation, all these things in moderation. You're better doing a little of things rather than going all out. So like with the exercise, don't make them run up and down the stairs. Just do little and often exercises. There we go.
Perfect. Number 8 for me is keep them warm. Like we were talking earlier. Again, I don't know if there's any studies out there really showing the benefits of keeping an elderly arthritic dog or one with muscular compromise. But I know that in my short time as a vet, 19 years, I've seen great benefit in keeping these dogs warm, warming them up for exercise. And I experienced it a lot with my own dog. So it's a freebie, use it.
I'll go next with talk to your vet. We always have, I see this on the chat rooms that, I don't want to talk to the vet. She might disagree. Well, just ask. I mean, if you ask them, they turn out to be a terrible person. Well, you can change vets. But probably you'll find that actually they're interested in this and they're going to say something helpful. And they'd probably be delighted to be asked. If you don't ask them, you'll never know. And you may well just get just as good information from them as anyone, who does this to a higher level. They'll give you good, sensible information. So don't be scared to ask because they'll be on your side.
I'm going to add to that. Nurses are amazing.
Mm-hmm.
There was this study where they looked at who was more empathetic. It was
that would be the nurse. Yeah.
So they have got more time. They listen more because we butt in more. They look at
just watch this video for the last hour and you'll see what we're like.
So take advantage of your nurses. They're fantastic people.
That sounded really bad.
That sounded really bad. No, don't take advantage. Make sure that you utilise your nurses because they are an absolute wealth of information as well. So don't just go for the white coat vet. Say to your practice, do you have a nurse-led clinic for arthritic dogs?
Mm-hmm.
Number 5.
Is that me? So I would say, I'm trying to work out how to say this. Don't get too tied up in tiny, tiny details and percentages. Look at the big picture. So a laser is better than a heat pack, but it also costs about 4,000 times as much. So, and it's the same when people, you'll get people coming to me saying, oh, well, this food has got 1% more protein than the other. And you're like, well, they're both good dog foods, Don't get too stressed. Make sure you buy a good dog food. Don't stress over one is 1% more than the other. And that's true in arthritis, where you'll find people, I can see them on on the internet, and they'll be stressing over tiny details, which compared to actually all the good they've already sorted out, they don't need to worry about that so much. Don't throw away the time you've got left with your dog worrying whether you should be giving him this capsule or this capsule. Enjoy them. They're there for enjoyment. And rather than stressing about it all the time, find someone who knows the answer and ask them.
Cam, you can always ask Cam a question, because if we don't know, we look it up, we go and research it.
Yeah, we look it in a book. Google it.
We just go on Google quickly. No, we don't. We do not. Number 4 for me is, and it's so important, it's why Cam started, is home management. You know, I see dogs that are on Metacam, gabapentin, amantadine, they're having physio, and they're only letting them do the wooden staircase, walk across the laminate floor, there's tripping over the back steps to go for a wee in the dark, the patio's slippery, and I sit there going, what are you doing? You know, get your home care. You would not put your granny with mobility issues on a slippery varnish floor and a pair of fluffy slippers. So please do a foundational. Number 3.
Yeah, so number 3 would be taking on from that, the granny point is just reflect what you would choose if you were the dog. Just imagine yourself in their place. Almost all of the stuff that, you know, people stress about, like dog behavior, for example, is just put yourself in the place of the dog. Don't start thinking about some TV show about wolves. Just think, if I was the dog, you know, the dog likes to put his hip next to the radiator, so he probably likes heat packs, that kind of thing. Yeah, I wouldn't make my granny run up and down the street because she's got bad legs. What would I do? What would I actually do? And you know what you would do if you think about it. So often, especially if you've got arthritis yourself, you can often transpose. I'm not talking about drugs here. We're talking about yeah. Don't start giving cocodamol or anything like that. No,
don't do that.
I'm talking about physical therapy at home. So where was that? Number 3.
Number 3. Yeah. So I'm on number 2. Already. So for me, I've only got one thing to say. It's going to be, let's talk about it. I would like anybody that listens to this, please talk about it, because we're going to do somebody else a massive favour. We have so many owners out there that absolutely adore their dogs, and they really do just see their dogs growing old or getting stiff, or that behavioural issue that's cropped up. Oh, it's just a behavioural issue, when actually underlying it is potentially pain. If we talk about this more, then more people will feel comfortable about seeking advice and getting their dogs the attention that they need, and more dogs will live a lot longer and a better quality of life. So talk about it, please. Number 1 for you.
It is a team sport. Team sport. So this is a double one. So this is for owners, is that, like we were saying about moderation, you need to do multimodal things, and that's not just in drugs. So you're doing your home care, your weight loss, your massage, your physiotherapy. You know, you don't need to. This doesn't need to take over your life. If you're sensible about this, if you're sensible about it, you do not need to just be that person who has an arthritic dog and that is all you do your whole life. You can target these things and do them sensibly and get advice and do these things. For vets, what I mean is, you don't have to be the be-all and end-all. Just find yourself a good physiotherapist you trust, outsource that bit, you know, and things like that. And I think a big take-home message for people is how much benefit for how much input. So, and I always do this as a surgeon, you know, how much benefit from how much input. So if I'm going to do a surgery, how much better will I make the dog for how much risk or impact or whatever? And if it's a good deal, I'll do it. And if it's not, so same with these, you know, heat pack, quite a lot of benefit for almost zero input. Now, if you're talking about supplements, you might get a tiny increase. If this is a £1 a week supplement, brilliant. If you're being asked to subscribe for £1,000 a month, it's not worth it. And the same when you get to more expensive things like surgeries and lasers and whatnot. Find out, like, how is it going to change things? Is it going to make a massive difference? In which case, it's worth the investment. Is it going to be a very expensive, tiny difference? No.
Yeah.
No. Use your money more sensibly. And the same with your time is, you know, 5 minutes with a heat pack, it hardly interferes with your day. It's the same with the dog. Stopping him jumping out of the car, helping him out of the car, does not interfere with his day at all, but it's good for his joints. So you're making changes that are kind of almost zero impact, but will give good benefit. So it's working out that benefit versus impact. That's important. So work out if it's worth doing.
We've got a lovely booklet called Managing an Arthritic Dog in a Busy Home, which gives you loads of little bits of advice for those, as you say, simple change to your routine, doesn't take long, massive impact. Just to promote a lot of the cam goods, we are self-funded. So if we impress you with our amazing knowledge, go to the shop, buy some booklets, buy the cards, disseminate them. Whether your dog more years beanie, we've got the snood, we've got the hoodies. Please support us because funds are really tight at the moment and we're trying to keep this going. Thank you, Jamie. You are,
that's all right,
as per usual. If everybody would love to say thank you to Jamie, he might come back with his halo. Did you notice the halo?
I like that. That was really good. Yeah.
Thanks.
Thank you for that. I felt really special.
Thank you so much, and we will see you guys on Thursday, where I've got the lovely Jane Davison, who's going to talk all stuff in practice. What can you get out of your practice? So we're back again on Thursday. Till then, thank you guys, and we'll see you later.
Bye.